and gentlemen, to the podcast. We got a special guest in the building, Denise. And you are a registered nurse?
No, I am a licensed vocational nurse. I am a certified pharmacy technician. I am a licensed life, health, and medical insurance provider. I'm a mom. I'm a little bit of everything.
For real. All right, we gonna get your story out here today. Why don't you go ahead and tell me a little bit about yourself?
Okay. I'm from Kansas City, Missouri, as y'all all know, 816. I was raised in the Swope Parkway area, and I graduated. I went to college. Well, I'm still in college. I've done pharmacy for over like 15 years, and I've been doing nursing now for about 3 years. I have children. I'm married, and hey.
Okay. So why did you, or why did you move to Texas or whatnot? Why did you want to start your life out here or whatnot? Was it a better opportunity for your job?
It's really a funny story. When I moved here, I had no big plan as far as I'm gonna move there for a job. I'm gonna move there. I moved here to follow my grandmother. Like, I had no inclination that moving here would change my life drastically. I moved here specifically to follow her because, she raised me ever since my mom passed away, and she was like my heart, and so when my grandfather passed away in 2015, she moved here with my uncle and his family. And, I was in Kansas City, and I was just like, things just didn't feel right. Like, our base was gone, our home was gone. And so I was like, it was me and my daughter. I was like, I'm out. And I came here, and who would have known, my life just unfolded and blossomed into so many different things. When I got here, I finished my nursing degree. I met my husband. I had an additional child. I bought a house. So many things happened. And that's why I tell people all the time, sometimes you have to get outside of your comfort zone to receive bigger and more bountiful blessings in your life. I just, I never knew following her. That's all I was doing, was following her, was following God's plan for my life.
That's a pretty deep story. So you basically came out here to help take care of your grandma and keep an eye on her or whatnot?
I came out here to just be next to her, to be near her, you know what I'm saying? I didn't expect that things would unfold how they did. I graduated in 2020. I was a part of the COVID class of nurses that came out, and I graduated in July, and that September, we found out my grandmother had stage 4 colon cancer and lung cancer, so she was my very first patient, and it was my honor. It was the biggest honor of my life to be able to nurse her to, her last day. So
that's kind of interesting. So you end up moving out here because of her, then you end up start taking care of her at the same time, being her primary nurse or whatnot, or not primary nurse, or one of those people that's taking care of her, watching over her or whatnot, knowing her condition. And since you're in the healthcare field, you know a little bit more about it than most people, so it kind of worked out best, right?
I thought that was one of the best things. Me, my uncle, my aunt, we were all here, and we were able to take care of her in-house. We didn't have to send her to any facilities, any hospitals, anything like that. We were able to nurse her until she passed on at the house. And it was, like I said, it was one of the greatest honors of my life. I was there with her until her last breath, literally.
Man. So do you miss Kansas City at all?
I miss people in Kansas City. I miss, I had some good times in Kansas City. Like, Kansas City helped shape me. TV Watkins Project, Champs on 39th and Jackson. There's just so many things about Kansas City that Westport, World of Fun, so many things that shaped me and made me into the person I am, gave me the street smarts that I had to get through and navigate life the way that I do.
Yeah, no, you made a big change in your life, and I can see it, and I love it. So I remember going up there to Cash American Pond off of 31st and Chestnut, coming up there trying to get a discount or whatnot, see what you was up to or whatnot.
Yeah, I used to work at the pawn shop.
And now look at you, you got your own family and everything, you're doing good. So what you talk about some of your job experiences and whatnot. What about, it looked like you just got off work today. What you talk about your job? So what happened today at your job that's kind of interesting?
Well, I just got off of a 13-hour shift. I was supposed to be a 12-hour shift, but that's one of the major downsides to working in the medical field and nursing field. It's just so unpredictable. You never know. Most people, they work a 9 to 5. You come at 9, you get off at 5. But with nursing, you just don't have that guarantee. Sometimes you have people that don't show up. Sometimes you have, you know, situations like my situation today was I had to stay an hour later to pass meds. That was somebody else's delegated responsibility. But unfortunately, because I was the nurse on duty, it fell to me. If the med tech doesn't handle her business, I can't just leave it. So therefore, I had to do what I had to do.
So it hasn't been days that you didn't want to go to work because some of the situations at work or patients past?